Here is your stem.
Okay, I'm ready.
Both are ready?
Yes.
Okay, so if you've read and understood, considering it communication skills station, please begin.
Hi, I'm Dr. Fiong. I'm one of the surgical doctors. I understand that you're here for your surgery today.
Yes. Hi, Dr. Ofyong. Can we proceed with the surgery? I've been waiting for too long.
Oh, I'm really sorry. Unfortunately, we won't be able to do your surgery today. I'm really sorry.
Is this a kind of a joke, Dr. Ofyong?
I
This is
understand how you
totally
feel.
unfair, Dr. Ofyong.
I sincerely understand your concerns. I'm really sorry. The reason for the cancellation was because the consultant that was supposed to take the case today was called for an emergency. And he has gone for the emergency and won't be available to have your surgery today. I'm really sorry. I really
That,
apologize.
that's really frustrating, Mr. Ofyong. And could you call him because this pain is being a severe pain and it's really affecting my job. Could you please call the consultant?
I understand your concerns. I'm very sorry. You know, just like I said earlier, he went to attend to an emergency, and calling him will be distracting him. I'm really sorry. I totally understand your concerns. I read through the records and I saw that the case has been cancelled twice. I'm really sorry. I just want to let you know that it's been an emergency, it's a life-threatening situation, and when cases arise like this, the consultant has to go to attend to them. I'm really sorry, please.
So my case is not an emergency.
Like I said earlier, emergencies are life-threatening. So in situations like that, we'll have to prioritize life-threatening conditions. So that's why the consultant is not available today. I'm really sorry.
But I think my surgery is very important because it's really affecting my job. I work as a postman, and I have some financial problems, and this will really affect my life.
Oh, yes, this is very good concern you raised. I sincerely understand your frustration, but don't worry, I'll help. I'll try to write a letter to your employer,
Mm.
explaining to him that we rescheduled your surgery and seeking for him to extend and give you some more days in your sick leave. I don't even mind getting to call him if you want me to. I'm really sorry.
Okay, no problem. And so, can you promise me that I will next time will be my surgery in the next operation list?
Oh, unfortunately, if there happen to be another emergency, we will have to prioritize the emergency. I can't promise you that, but don't worry. I'll relay your concerns to the consultant and let him know your situation and how frustrating it has been for you. And we'll try to see how we can put you in a list soonest. I'm really sorry. And we'll get to reach out to you and contact you once we get a date.
So, can you give me an exact date?
I can't give you an exact date at the moment. Sorry. I'll need to speak with the consultant, and like I said, I'll relay all of your concerns and your situation to him and see how we can give you this a sooner date. And once we agree on a date, I will contact you. Don't worry. I'm really sorry.
No, no, Dr. Ofyong, this is totally unfair. Uh, I would like to see another consultant. I'm gonna see another doctor.
I totally understand you, and you have every right to choose or see any doctor you want to see.
Mm.
But unfortunately, the concern we have is, if you choose to see another doctor, we'll have to start all over fresh. The doctor needs to see you and review you, and
Mm.
it's going to take a lot more time. So I don't really advise that.
Okay. Is this delay gonna affect the success of my surgery?
Fortunately, is not going to affect. It's not going to affect it. Like I said, it's just because of the emergency that came up today that the consultant was called to the ER. If not, it would have been done today. I sincerely apologize.
Okay, and Dr. Ofyonga, yesterday one of your colleagues come to me and said the procedure was something called arthroscopy or something like that. Could you explain more for me so I
No,
could I could
it's
uh,
fine.
I could
It's fine.
understand it?
It's a very good question. Don't worry, I'll explain it to you to make it easier for you, okay?
Mm,
So I'm going to draw an illustration just to give you a picture of what the procedure entails, right?
okay,
Okay.
and I want to
So
know exactly what is my case, and so I don't have any idea about it.
okay, it's okay. All right. So you imagine that this is your thigh, all
Mm,
right, and this is your leg, and this is your knee, all right?
okay.
So in the knee, we have something that is usually here, a tiny C-shaped structure we call menisci.
Mm,
And it just simply means a cushion-like structure that helps absorb shock in the knee joint.
mm,
So your GP saw you and suspected that it might have been injured. So what the procedure basically entails is that we'll give you something that you won't feel pain from your waist down,
mm,
and then we'll clean the skin around your knee,
mm,
and then we'll create a small cut
mm.
where we can insert what we call an arthroscope. It is simply a camera that we'll put in, and then we'll project it on a TV screen such that we can see the knee and whatsoever problem that is in the knee, and then the surgeon will be able to repair it, or if it needs to be removed, it will be removed.
Okay. Okay.
Mm.
And what type of sedation or what type of anesthesia I will receive?
Okay, we'll give you an anesthesia that you'll be awake, but you won't feel anything from your waist down to your leg. You won't feel anything. Don't worry.
Okay. And will I have to stay overnight in the hospital or can I go home?
Okay, usually this is a day procedure, so
Mm.
you should go home the same day. We'll just keep you for some few hours, and then once you're stable, we'll let you go.
Okay. And what's really concerned me is when I will be able to walk again.
Okay, after the procedure,
Mm.
within the next few days, 4 to 5 days, you can walk, but you need a walking aid like crutches.
Mm.
And then in 6 to 8 weeks, you should be able to go back to your usual activities. So don't worry.
Okay, and Dr. Ofyong, they describe me an analgesia painkillers, but I have some tummy pain. I think there is something wrong. What do you think it is?
Oh, I'm really sorry to hear about that. It must be very frustrating. Yeah,
Mm,
there are some painkillers that get to disturb the tummy, you know.
mm.
So, but don't worry, I'll look into the prescription and then change to another painkiller that is milder with the tummy. Okay, don't worry.
Okay, and since you postponed my surgery, what can I do until the surgery?
Okay, while we wait for the surgery, I'll advise you if you feel any pain, just like I said, I'll give you
Mm,
some painkillers, and then I'll advise you to do some non-weight bearing exercise that can
mm,
strengthen the knee joint,
mm,
like swimming, and then I'll get to speak with the physiotherapist that can
mm.
come around once in a while to also help relieve your pain and strengthen your knee. Don't worry.
Okay, and since I am at home and not moving much, I have started to gain weight, and this is really bothering me. What should I do about it?
Oh, I understand your concerns. I'm really sorry about that.
Mm,
Okay, so I'll get to speak with the physiotherapist to uh to prescribe some very good non-weight bearing exercises
mm.
that can help control your weight. And then I'll also speak with the dietitian, and then they'll also contribute and see how we can help you and make sure you don't we control your weight, right?
Okay, and one last point, Dr. Ofyong, my knee pain is unbearable, and really, Dr. Ofyong, the painkillers which you gave me isn't helping anymore. What should I do?
Oh, I'm really sorry to hear about that. Don't worry, I'll get to speak with some other senior doctors, and we'll
Mm.
get to know if which other stronger pain medication that we can give to you that will not be so very addictive.
Can I
And
take morphine, Dr. Ofyong?
it's like I said, I'll need to speak with other senior doctors. We'll have to look for other options that has less addictive effect. Don't worry, I'll give you a better, stronger painkiller.
But
I'm
Dr. Ofyong, I'm really disappointed, and I want to file a complaint because this is the second time, and you said to me my surgery is not an emergency, so I need to file a complaint.
Okay, I'm really sorry to hear this, and I sincerely apologize for rescheduling your surgery. Like I said, I told you the reason why it was cancelled, because of the emergency we had today, and the consultant is not around. So, but if you still see a need to make a complaint, no problem. I'll direct you to the patient advice and license service, so you can get to direct your concerns there, and they'll see how they can help you. I'm really sorry.
Yes, refer me to them, please.
Sorry, no problem.
Okay, thank you so much.
All right.
Thank you.